So Dr. Fauci has been facing some questions in recent days about why, over the course of the pandemic, he has changed his estimate over what percent of the population would need to be vaccinated against coronavirus before we would have herd immunity. This is from the New York Times. They say in the pandemic's early days, Dr. Fauci tended to cite the same 60 to 70% estimate that most experts did. About a month ago, he started saying 70 to 75% in TV interviews. Last week in an interview with CNBC News, he said 75, 80, 85% and 75 to 80+%. So he's been edging up the number from 60% now all the way to 85%. And Rachel, the justifications he's giving with this are incredibly sketchy. I mean, basically, he's admitting that he didn't think the public could handle the reality of how high an immunity rate you would have to have within the population before we could, quote unquote, get back to normal. In a telephone interview, he acknowledged that he'd slowly but deliberately been moving the goalposts. He said he's doing it partly based on new science and partly on his gut feeling that the country is finally ready to hear what he really thinks. Hard as it may be to hear, he said he believes it may take close to 90% immunity to bring the virus to a halt. He got pressed on this. Dana Bash actually pressed him on this over the weekend. Let's take a listen to what he had to say.
We have to realize that we have to be humble and realize what we don't know. These are pure estimates, and the calculations that I made, 70, 75%, it's a range. The range is going to be somewhere between 70 and 85%. The reason I first started saying 70, 75, I brought it up to 85. That's not a big leap to go from 75 to 85. It was really based on calculations and pure extrapolations from measles. Measles is about 98% effective vaccine. The COVID-19 vaccine is about 94, 95%. When you get below 90% of the population vaccinated with measles, you start seeing a breakthrough against the herd immunity. People starting to get infected like we saw in the upper New York State and in New York City with the Orthodox Jewish group when we had measles outbreak. So I made a calculation that COVID-19, SARS-CoV-2, is not as nearly as transmissible as measles. Measles is the most transmissible infection you can imagine. So I would imagine that you would need something a little bit less than the 90%. That's where I got to the 85.
Rachel, what do you make of all this?
Well, look, I think that this whole COVID-19 pandemic has shown us that people are willing to give a lot of grace to public health officials and put a lot of trust in them. You know, polling has consistently shown, that Americans take COVID-19 seriously, that they are willing to sort of alter their lifestyle because of it. But pandemic fatigue is also real. And I think you just add to it when you constantly have these same medical professionals coming out and say, well, we just need to do this to get to, outcome X. And then you reach it. And then it's, just out of reach again. And then it's just out of reach again. And then you just start tuning people out. And I think that's the real fear here, is that when you keep moving the goalposts, people are just going to stop listening to public health officials at a time when maybe they need to still be listening to them. And moreover, this is not going to be the last pandemic that we have, right? We live in a globalized world. We are going to see infectious diseases come around again. Public health officials are eroding a bank of trust that people have placed in them, so they may not be as willing to listen in the future. And I think that's really ultimately the most concerning outcome here.
That is exactly right. And just to give you a little bit more of his justification here, and again, this is from the New York Times, he says, when polls said only about half of Americans would take a vaccine, I was saying herd immunity would take 70 to 75%. Then when newer surveys said 60% or more would take it, I thought I can nudge this up a bit. So I went to 80, 85. It's not your job to read polling of how you think the American people feel and what you think they can handle. It's your job to tell people the facts and the science as best we can figure. And if it's a range and there's a need for humility to say, look, it could be 65%, it could be as high as 90%, it's somewhere in that range, we don't know exactly, then say that. But it reminds me so much of the early days of the pandemic when we got this whole song and dance about, oh, masks don't really work, don't run out and buy them, they may actually make things worse, you may be more likely to contract the illness if you wear a mask ultimately. And then we learn, why were they saying that when they knew the truth that masks were in fact, they do in fact work, they do in fact help you prevent from getting sick? It's because they were afraid that people would have a run on masks and they would keep them from getting from frontline healthcare workers. Well, look, I understand that impulse and that instinct, but you have to trust people with the information. And that misstep from the very beginning of just flat out lying to people about the efficacy of masks helped to create the whole politicized nature of the stupid mask debate and began to erode trust in public health officials, just as you're saying. And to me, this is the exact replay of that approach of like, look, I know the truth, but I don't think the American people can handle it. So I'm going to handhold them and feed them the information that I think they want to hear and can handle hearing, rather than what the actual truth and facts and science of the situation are.
Yeah, the same is true in public health as true in politics. You have to be straight with people. You cannot shade the truth. You cannot nanny people along. You have to be honest with people, and you have to be honest when you make mistakes, and you have to take accountability for those mistakes, which is something we also don't see enough of in politics or public health. Again, this is Fauci sort of tinkering with people's lives. Our whole public health debate around COVID, we tend to, I think, sometimes act like, oh, if we're not very careful with what we tell people, the American people are going to run out and start licking doorknobs or some incredibly risky behavior. But again, Americans have taken COVID seriously. To your point, the comfortability people have with the vaccine is only rising. Right? More people now will say they will get the vaccine than 2 months ago. More people now, I live in an area with very high mask compliance. People are still staying home and altering their behavior. They take COVID seriously. And so when you have people start taking advantage of that trust, or start sort of, tinkering around the edges of sort of a social engineering approach to what information you're going to give people, you have to trust people, especially when it comes to their health, to make the correct determinations, because this pandemic has shown that most people will. And so again, Fauci can do what he wants, but he's undermining the entire profession, and I think it's really going to hurt us going forward.
Yeah, I mean, to be honest with you, it kind of reminds me of what came out in the Woodward tapes of Trump, where he knew very early on, he knew it was airborne. He was coming out and saying, oh, it's just like the flu. Privately, he's saying to Woodward, this is way worse. I mean, he's literally saying this is way worse than the flu. It's way deadlier than the flu. And then he admits, look, I wanted to downplay it. I didn't want people to know the truth about how risky and how terrible this thing ultimately could be. Again, it's not your job to decide what people can handle. It's your job to be honest with them and present them with the facts. And the fact that you had essentially no one coming forward, and especially in those early days, and just being straight with people, I think is part of why you have this incredible COVID fatigue now, part of why you've had this, we covered the polling here of how the response in the U.S. is more politicized than anywhere else in the world, like these stupid culture war fights over masks and social distancing, and the way you feel about the response is much more dependent on your political party here than other places around the world. And I think you can trace it all back to people not being honest and upfront and direct from the beginning of this thing. It just erodes trust. It fuels conspiracy theories, and it makes it so that people are more likely to look at this through their partisan lens and decide what they want to believe versus trust the information that's being presented to them.
It makes people assume that they're being lied to. Right? Instead of saying, okay, I can probably trust what's being said because, this institution or this person, they just assume they're being lied to. And can we talk about how damaging that is from a public health perspective? Yeah. If people just assume that, the nation's top doctor might be lying to them or misleading them in some way for some political end, that's a bad trend that I don't think we can walk back from. And I think fundamentally, to your point, that informs the U.S. response over somewhere like Europe, where it's far less politicized because people just have a reason to be less skeptical.
Yeah, the story of 2020 has been institutional failure all the way around. It's very depressing.
On every possible level.
Indeed. Yeah. All right, next on Rising, we got friend of the show, Michael Starr Hopkins. He's going to join us alongside Rachel for the panel. That's when Rising returns.